Okay, good afternoon, everyone. Yes, it is afternoon. I was just checking, and you're all very welcome to our Lunch and Learn session. I love that title, Emily. My colleague Emily Watts, is our marketing manager with our school here in the School of Nursing, Midwifery and Health Systems in UCD. And Emily has prepared this Lunch and Learn information session for us all to deliver today. And we're delighted so many of you were able to log in. My name is Rita Smith. I'm the Associate Dean for Taught Graduate Studies, and my colleagues are online here with me today. My colleague, Associate Professor Eileen Furlong. Eileen is the Director of Graduate Clinical Studies. My colleague, Dr. Deirdre O'Donnell, is the Associate Professor for Research and Innovation, and also my admin colleagues are with me as well. Emily, as I said, our Marketing Manager, and Paul is our program administrator, and I think some other colleagues are there as well. I can't see their names just now, but you're all very welcome. And I'm just going to do a very brief overview presentation to give us a flavor of our school and our programs, and we're going to have an opportunity then for you to ask any questions that you have. Paul is going to go through the application process. Deirdre is going to do a short presentation on research and PhD scholarship opportunities. And then any questions, we're more than happy to take any and all of your questions. And also, there is no problem. We will be able to follow up on any questions you may have after our session today. So I suppose it's really important to welcome you on board and to really say and to encourage you to make the choice to study with us. We acknowledge that undertaking any program of study is difficult, but we also know that educational programs linked to clinical practice will enhance your practice and are really valuable experiences for everybody. We're very conscious of the challenges in clinical practice, and we all know, and we're still, as we all know, emerging from the effect of the pandemic. But I think as educators, it's important for us to acknowledge your commitment to patient care and to your nursing career by considering coming on board with us and taking a further study at this time. One of the strategic goals of UCD as a global university is a focus on enhancing health and well-being and building a healthy world. And I think all of us in education and in clinical practice are working towards that goal. So, you know, we have a mission to prepare nurses, midwives, and other professionals to promote and protect health, well-being, and dignity across the lifespan. And our whole focus is the development of skilled, ethical, and careful practice based on best practice evidence and prudent judgment. And of course, our focus is also to disseminate disciplinary knowledge through research and scholarship. So we're the largest graduate school. Our whole focus is to lead in education, research, and practice to improve healthcare. And we have an environment here in our school of academic excellence, and we have very strong partnerships with our clinical partners across the Ireland East Hospital Group. And it's really important that we flag our clinical partners, because essentially our links with our clinical partners really form the bedrock of our educational programs. So we're delighted to support learning and practice and to work with our clinical partners across our programs. Of course, we continuously expand professional boundaries, and our focus is to prepare exceptional graduates who have the attributes and the skills and the education to provide excellence in clinical care, and also graduates who are focused on lifelong learning, because essentially, I guess, as we go through, lifelong learning is really, really important. We deliver our graduate programs conjointly with our clinical partners in the Mater in St. Vincent, in Our Lady's Hospice, Hares Cross, and in Children's Health Ireland. So our graduate programs really are very much built on a partnership model. So I suppose the reason why you've logged in today is to think about your future. And we, to do some blue sky thinking, although I've quite a lot of clouds on that slide there, our focus really is to provide taught graduate programs at master's, graduate diploma and professional certificate level that will enhance your practice. I forgot to put, I'm just realising now, I forgot to mention our colleagues in the National Maternity Hospital. Of course, we have a whole focus on midwifery as well within our school, and we provide the program, the Master's Advanced Practice Midwifery. So it's important to include our colleagues in the National Maternity Hospital also within our partner hospital group. So as I was saying, our graduate programs provide excellence in education. Our focus is on best practice. Our focus is on building graduates who are really steeped in evidence-based practice and at the cutting edge of care. We have a record number of graduate students, and we're delighted to offer, again, a very large suite of graduate programs for the coming academic term. So we've got clinical leadership management programs and programs of research. Okay, so many of our graduate programs, as I've said, are in specialist practice areas, in children's nursing and in midwifery practice. You will be familiar perhaps with some of our programs in intensive care, cancer nursing, cardiovascular nursing, palliative care, gerontology, chronic illness. So our specialist areas of education are really quite wide and diverse. We're the leaders in education for the Masters in Nursing Advanced Practice and also the Advanced Practice Midwifery. And we've also got the suite of registration programs for prescribing of medication and referral for ionizing radiation. We have a large suite of leadership programs. We provide the National Foundations Program in Critical Care in partnership with UCC and the ONMSD. And our PhD program that Deirdre is going to speak to you about supports clinical education and research roles. And we have a very large suite of CPD programs with our clinical partners, colleagues, and our CPD. We have a designated director of continuing professional development programs, and our accredited CPD programs really are excellent stepping stones towards further education. So this slide really is a kind of a whistle-stop overview, and kind of reiterates maybe in some way what I just said, but we've got clinical graduate diplomas, professional certs, masters, all in those areas of specialist practice that I just spoke to you about. And as you know, they allow us to develop education in specialist areas, move towards clinical nurse specialists, nurse prescribing, then towards advanced practice. We also provide the MSc, the graduate certificate in healthcare education, to develop colleagues who wish to go into education. We have a broad range of programs in leadership, innovation and management, and also with Lean Six Sigma in partnership with the Lean Academy and the Mater. So we have a large suite of leadership programs and obviously, as I flagged, programs leading to, in research and development of research scholarship. Our health systems colleagues, we have a number of programs linked with our colleagues in our health systems arm of our school. So they provide interdisciplinary, applied and experiential focus. The programs are aimed at health professionals at all levels and at all levels and all settings within the health system. And they focus on strategy and innovation to foster collaboration across traditional boundaries, to develop safe, high quality, responsive, person-centered care. So our health systems, and we will view that on our website. We're going to go through our actual website where you can really review all our programs. But our health systems colleagues really are providing cutting edge leadership programs within our school. So this is our web page interface, and Emily is going to talk us through. I don't know if you want to do that now, Emily. If you want to talk through.
That's no problem. If you just stop sharing there, Rita.
Yes, no problem. Thanks, Emily. We're here for questions, so no problem at all. If anybody wants to put up their hand or wants to put a message in the chat box, that's no problem at all.
So hopefully you can all see that now. And Eileen, Rita, do feel free to cut in at any stage. But just to show everybody, so the UCD website, the link is up here. So this would be www.ucd.ie/NMHS. And if you're looking on our website and you want to locate where the Talk Graduate programs are, you would just go up to the menu at the top here, click the courses button, and then you'll see Talk Graduate. And then if you are looking at the PhD opportunities that Deirdre will be speaking to later, you would go to the research section here. When you do open this page, you'll see that we have categorized our programs into various different disciplines. So you can go into each one of these and they will have a list of the different programs which you can click into for further information. So hopefully that's covered that, Rita. Is there anything else you want me to go through there?
No, I don't.
No, thank you. No, I think now perhaps if people have questions, probably, because now that you've shown them the interface, thank you, Emily.
Thanks, Emily.
And our website has been updated recently. So for people who haven't looked maybe in the last 2 or 3 months, it is a brand new interface, which actually has been complimented. I know people really like it. So hopefully, folks, hopefully you're getting some lunch as you're listening to us, but hopefully as well, you're obviously welcome to turn on your camera, but you don't have to. If anybody wants to ask questions about specific Talk Graduate programs or even generally, we're here. I mean, this is, it's we don't want to be doing all the talking, so we're happy. And if we don't know the answer, we'll direct you appropriately. So you can sort of see, and Rita's already introduced that whole suite. So obviously, many of you, and I recognize some names, which is lovely, on the screen. So some of you have definitely been with us before. So you know UCD, you know our school, but perhaps you're interested in either something advancing where you currently are, or perhaps slight change of direction, and either are all good to know about. So so I'll stay quiet for a minute, because I know if I keep talking, I'll be coming with the question.
Thanks, Eileen.
I know I have a question here in the chat box. If that's all right, I'll read it out, and if we can answer it, that would be great. Thank you so much for the question. So the question is, hi, I work in rheumatology unit. I'm hoping to do the postgrad in chronic illness. How much does it cost is the first question. And then the second question, is there much travel involved or any placements required in Dublin? So I'm not too sure if we can assist with these queries.
I'm just
checking first if Anne is on before because sometimes I end up coming in front of her, and Anne Donoghue, Dr. Anne Donoghue is our program director for gerontology, but maybe not. No, at the moment.
I think was it chronic illness, Eileen?
Oh, sorry, did I get gerontology from that? Sorry, which was it, Emily?
Yeah, it's the postgrad in chronic illness.
Oh, my apologies, and that's Tara. My apologies.
Sorry, no, I don't.
I heard something different. Yeah. So cost-wise, first of all, Emily or Paul, do you have the cost generically? I know we have to be careful with cost, but for the postgrad.
I'll look at that in the background. Maybe go to the other question.
I was going to say, for questions such as that, for the more generic things revolving cost of programs, I can look them up in the background and then put the answers into the chat box. If everyone's happy with that, just because they will vary slightly depending on program to program.
Yes, of course. Yeah, and then we're giving, that's what I'm saying, we need to be careful that we can't give an exact amount, and things, you can change. In regard placements in the chronic illness program, I know all of our clinical orientated graduate diplomas do have a clinical practicum. but I can't say, and we'll have to direct you to Tara. Do they go externally, Rita? I actually don't know.
Yeah, I'd have
Yeah.
to check with Tara the exact number of days. If there are supernumerary days,
Yeah.
I'm not sure where our colleague who's inquiring about chronic illness, where you're working. It might be in a regional rheumatology unit. The chronic illness rheumatology modules are delivered in Our Lady's Hospice, so we're very fortunate that we have that expertise over in Our Lady's Hospice who teach the specialist rheumatology content on the program. So I'm not 100% sure if they have supernumerary placements. I do know it's all our graduate programs are very blended, but you can follow through. We can send you our program director's email, or we can just check on our website about the contact person for the chronic illness, but I'm not specifically fully aware of the number of specialist programs.
Paul has put up the cost there. Sorry, where did you see that question, Emily? Because I can't see.
it was just a direct question to
myself. That's fine.
So
that's
sorry.
Okay. That's fine. No, I'm thinking, was it under Q&A or chat? That's fine. No problem.
Yeah.
Emily, can I just interject? I think we'll stop the recording for the question.
Oh yeah.
Thank you.
Apologies. Yes, I'll do that now.
Thank you.
We'll pause it. Yeah.
Screen. Is that okay? Can you see that now? Put it on full screen. Is that okay?
Yeah, that's fine, Deirdre.
Yeah.
Great. Okay, so thanks a million. I'm just going to kind of run through an overview of research degree opportunities. So this would be in the master's and PhD research programs that we offer in the school. In order to set that up, though, I'm just going to do a little bit of an overview of where we are at with our research domain. So this is an ongoing and developing piece of work that Eileen can testify to has been a lengthy process, but we're getting there in terms of trying to map some of the research activity in the school into different domains and really identifying where we have a track record of experience that we can offer and that we hope to build on with our research degree programs, as well as with our own funded research as well. So it's just trying to give you an idea of what we're doing currently in the school in the research world that maybe might spark an interest, and maybe that you could open up opportunities for you to think about your own, where you might contribute in your own research development as well. So just to say, at the moment we're working with kind of 4 research domains, which is that's actually changed now. This is how topical these changes are happening as we go, because we are working on this project as we're ongoing. But it's now called Integrated Health and Wellbeing. We have Educational Research and Practice, Advancing Care Practices in Nursing and Midwifery, and Health Systems and Inclusive Healthcare. So I'll go through each of those domains as they're currently conceptualized, and starting to think about some of the activities that are ongoing in the school that maybe might align to where your own interests might be. I'll also just have a quick word around the research centre in the school, which is our current research centre, which is the UCD Iris Centre, which is Centre for Interdisciplinary Research, Education, Innovation and Health Systems as well. Okay, so the first domain, as we said, is Integrated Health and Wellbeing. So this is domain really looking at how to support people to live well in their communities and across care transitions, so across different sectoral transitions of care, so from primary through to secondary into rehabilitation as well, care, so across their lifespan. And we have a couple of themes emerging from within that domain, including a focus around maternal and infant health and well-being, the health and well-being of children and young people, later life well-being, family care, and as well as a focus around care transition as well. The domain leads for that particular domain are Dr. Suja Somanathan and Dr. Denise O'Brien as well. And they're currently leading that domain. If you're interested in maybe exploring a little bit around how your research might align there, it's worth contacting them for that. Sorry, and this is just to look at some of just examples of some very recent research that might be published that could be aligned to that domain, including a focus around rare diseases, family carers, chronic illness, as well as the quality of life of older people as well, and older people in this case who are experiencing dementia. Okay, so the next domain is around educational research and practice. Our domain leads for this domain are Dr. Catherine Redmond and Dr. Alison Clancy. So again, if you're interested in pursuing research that aligns to development of education, whether that's in the area of simulation or pedagogic development, universal design, also clinical practice development as well as educational technology, it's worth contacting either Catherine or Alison just to scope that out and to see maybe how your research might fit in with what's currently going on in the school in this area. Wow. And again, these are just some examples of recent outputs in relation to this domain, including an evaluation of the nurse practitioner role, designing and developing core physiology learning outcomes, and then very practice-orientated education and evidence-based practice focus around, wound care, as well as looking at simulation for medication management as well. Sorry, I did say that one is being led by Catherine and Alison, yeah. And then domain 3 is being led by Eileen here in the room, which is great to have. So if you have any questions around this, I'm sure Eileen can help to think about where your research might align here. And of course, Dr. Kate Fraser joins Eileen as leading up in this domain. This domain is looking at advancing care practices in nursing and midwifery, with a focus of looking at integrated care pathways across all care settings, looking at outcome measurement and quality evaluation or evaluation of care as well. Some of the emerging themes under this domain or areas where we have a lot of ongoing activity would be around cancer care and survivorship, cardiovascular nursing, palliative nursing and supportive care, midwifery practice, as well as digital health technology. Wow. And then just again, some examples of some ongoing or just recent outputs from some ongoing research in this area, including looking at the clinical nurse specialist role in palliative care, looking at symptom management in advanced heart failure, nurse-led analgesia, sedation guidelines. There's cancer, experience of cancer and family caregivers experience of using e-health technology, as well as I guess there's a strong track record around looking at e-health technology in cancer care and cancer treatment as well. I know Eileen has been very involved in that research as well. And then domain 4, we have in health systems and inclusive healthcare, which is really looking at the systems in which people are working and people are receiving care, looking at the relationships, communities, environments, the policies and processes which condition the way health is both delivered as well as received. The leads in this domain are Dr. Brent Gilmore and Professor Eilish McAuliffe, who again would welcome any, like all the leads, any conversation that you might have if you have any queries or any kind of thoughts about how your research might align within those domains. They are open and looking forward to having those conversations as well and try to see how they could support you to align your research there. Health systems, some of the themes that are looked at within the health systems research include equity and access, organization and culture, which would have a strong focus around interprofessional collaboration and intersectoral collaboration there. Quality and patient-centered or person-centered process improvement with a strong track record in patient safety research, leadership and management, as well as at a really strong and emerging area of research around global health as well. Here's again just some of the recent outputs that have been of some of the research activity aligned to this domain, including research that's looking at the organizational factors around patient safety, looking at interprofessional collaboration, and looking in global health. There's a very strong maternity and midwifery focus in the research there, which is looking at how to looking at maternity care within low and middle income countries. We've also had a lot of strong research or strong track record of looking at policy implementation in health systems as well and tracking that and evaluating that too. Just to flag the IRIS Centre as well, which is a research centre within the school. It's an interdisciplinary research centre that pulls in collaboration from across the university, but centred in the School of Nursing, Midwifery and Health Systems. It operates under 3, I guess, pillars, including equity and access, quality and process improvement, as well as organizational culture. They have Iris has a website, a web page on our website, and the school website has its own web page, which is worth having a look at. Again, just have a look at the scope and breadth of the research that's ongoing in Iris, and identifying where maybe your own research interests might align there as well. Just to say in conclusion, I guess, I know that was very much a whistle-stop tour against on a quite a big school that's highly research active and engaged, and I guess just really some of the common connections, I guess, across all of those domains is our focus on very strong innovative methodologies, and that would be linked across all of the research. There's a really strong emphasis on evaluation, on implementation science, very strong emphasis on public and patient involvement in our research, with excellence in participatory health research methods, as well as an emerging excellence and establishment of an excellence in the area of realist evaluation and realist theory as well. So hopefully that has enticed some of you and whetted your appetites to think that maybe you could join this very dynamic and research culture in our school, and given you a few of the names that you can think of to contact if you want to consider how your research might align to the domains, and to join any of existing research activities that are ongoing as well. But we're always looking for expanding our collaborations. We're always looking to create new ideas of where our research can lead us next. And of course, a huge focus of our school is really trying to encourage those out in clinical practice to consider aligning their practice and professional development with development of their research knowledge, skills, and experiences as well. So our door is open, and we welcome you to come in and to speak with us and join this conversation.
Nice to see some names that we know are with us already.
Yes,
so
yes, absolutely.
That's lovely. Thank you.
Yeah, who can also hopefully testify to some of what we've said as well. So just to give you a little bit of an overview, just one of the ways and mechanisms that we have for you to come in and to work with us and to develop your research skills, your research training, is the formal research degree program. So we offer two research degree programs. So one is the MSc in research, MSc in Masters, the Master's research degree, and the other one is our PhD research degree program. So we offer both those programs in either a full-time or a part-time option. And for those of you who are in clinical practice, often the part-time option is quite attractive because you can combine that part-time registration with your clinical work as well. The MSc, the master's degree, it focuses on a major research thesis, again supported with a supervision panel. Typically, the full-time master's research degree is for 2 years. Again, the part-time option then would be 4 years, typical registration period. The PhD program is split into 2 stages. So we have stage 1, which is much more focused around development and training and education, so formal training and education. A lot of PhD students choose to use this stage 1 period to acquire 30 credits. So as a registration requirement, PhD students are required to take 30 credits of modules through their program. And a lot of students use this stage 1 as an opportunity to use those credits to support their training and development, particularly around research methodologies and systematic review or scoping review methodologies as well. Then once the students are ready to and feel prepared and ready to go out and commence their field work, they must go through progress on to stage 2. So stage 2 of the program is dedicated to their original doctoral research. It usually involves the field work, the data collection, and the analysis, and of course at the end the submission of their final thesis. That thesis we offer there's 2 approaches in the structured doctoral program in the university. So one is to submit by publication, and the other is to submit with the kind of more traditional monograph thesis style. And again, that's something that can be negotiated between the supervision panel and the student as well. And like I said, there are full and part-time options for the PhD program as well. So just a little bit of an overview of how the program is delivered. So whether it's a PhD or a master's program, students work under the supervision of a supervisor, and increasingly, and it's more encouraged, that a supervisor it employs a co-supervisor as well, so that there's essentially a primary supervisor and a co-supervisor to support the student. And then in support of both the supervisors and the student, there is a research studies panel established. So this is a panel that of faculty and external advisors who would have expertise in a particular, either the topic area or the methodology that the student is using. And again, it's an extra layer of resource and support for a student to have. They would meet at least once a year throughout the duration of the program, and twice in the first year, and really offers a sounding board and more advice again for both the supervisor and the student as they're going through the program. PhD students are required as part of the registration to take 30 credits of taught modules, but these are offered from across the university, which is really excellent. So we have students that are taking modules in organizational business, the School of Business. We have students taking modules in the School of Psychology, around, various different methodologies that might be offered there. So from across the school, and of course, they're taking modules that are offered within our school as well. But it's a lovely opportunity to really broaden out your education and to think about kind of different disciplinary perspectives on methodology or the topic area that you might be looking at. In addition to the supervision, the RSP, and the kind of structured formal education that's delivered through the modules, students are also supported through research seminars that we run once a month in the school for all of the PhD students. They're like a round table, very much a student-led seminar program. We obviously have excellent library supports, which hopefully some of you who have been students already in the school will be aware of, but a really excellent library support for students, and particularly for research students. We have a writing centre that offer excellent modules around academic writing and to support development of academic writing, which is attractive for students who are coming back into academia, maybe having been out in practice for a while and trying to just switch your brain again into a different way of writing and communicating that would be common within academic writing. There's also research integrity training, which is which is mandatory. And so there is a certain amount of it that's mandatory that I guess supports students in learning some of the issues around research integrity, including data protection, as well as ethics requirements, as well as some academic integrity elements as well. That can also be taken as a 5-credit module as well, the research integrity training. And then there's opportunities throughout the year to join and present your research, not only at our own roundtables and monthly graduate research seminars, but also at college-wide, so the CHAS research degree seminars as well, and showcases, as well as our own school conference, the first of which is running in August 2023. So what do our students say about the program? Well, I think, they overall have very positive things to say about their experience of registering in our program, particularly the confidence that gives them to go through this structured doctoral program, the support that they get from the school and from their supervision and from each other, because we really encourage and try to encourage our PhD students to form their own community of peer support, and to I guess support each other through these programs as well. So overall, we get very positive feedback from students who and from our PhD graduates who go on to talk about how the knowledge, the skills, the training, and their experience of the PhD program, how they've translated that experience into their professional development and the development of and scholarship in their discipline as well. Okay, so just before I kind of open this up for any questions or any conversations that you might want to have around this, just to flag to you our PhD scholarship program, which is open and seeking applications at the moment. We're offering either a full-time PhD scholarship or a part-time scholarship. So the full-time scholarship does come with a stipend. It includes your academic fees, registration fees for a maximum of 4 years. There is a requested contribution of a maximum, it's actually a maximum of 80 hours per annum to the school as well, associated with that one. Then there is a part-time PhD scholarship, which doesn't have a stipend associated with it, but does cover your EU fees for up to a maximum of 6 years. And there's no necessarily request around teaching contribution, although PhD students, there is opportunities for PhD students to teach if they wish. just to say on the full-time or the part-time scholarships, they are only currently eligible, so only open for those who are registered with the NMBI and are resident in Ireland. But we are welcoming and hoping that we will get applicants as it's currently open. So if you have any questions on that, please, we'd love to have a discussion about that. Ideally, we're looking to fund 10 scholars with a starting date of next September. Again, as I said, applicants do need to have a registration with the NMBI. The deadline is the 14th of April for that. If you want to have any more information, there's quite a bit of information up on our website around these PhD scholarships under the research tab of the website. But of course, you can also email Myrta at researchdegrees.nhs@ucd.ie for information. And of course, you can email me at any stage as well, overseeing the scholarship. These are some links. So just to have a look at the website again, and there's specific information there around our research domains, and there's links to some of showcase research projects under each of those domains as well. There's also a specific link here for the research degrees program, and also a link for more information around the scholarship program as well. These are just some contact details. So Myrta is responsible she's the overall program administrator for the research degrees program, and the main point of contact for all administrative support and queries for anyone interested in applying for research degrees, and of course for anyone who's currently in our research degrees program. And then there's my email address there as well for any queries that you might have around program.
And Deirdre, can I just clarify for people that if they're applying for the PhD, that there's and the scholarship, there's two process. Am I right?
Oh yes, you're right.
I just clarify that. I think people get a little bit confused with that.
Yeah, it is a little bit confusing. So so in order to apply for the scholarship, now it is probably a little bit better detailed than it has been in the past in the current process, but you would need to apply. Essentially, you submit your documentation to Myrta, and she puts you through the normal application process. So you'll get accepted onto the program, and then you'll hear whether you have the scholarship or not.
That's fine. Thank you. Yeah, I think there's a slight different date. So you said the scholarship is the middle of April, but is there a closing date?
No, it's the same. It's the same date for both.
That's fine.
We kind of make it a bit easier.
Okay.
Yeah.
Thank you.
So that 14th of April allows it to go through the next research.
Perfect. Thank you. I knew somebody else queried me on that. That's why I'm asking.
Yeah, because last year was a little bit confusing because we needed them registered because we were doing it over the summer, but now that we're doing it in advance of the spring.
Thank you. So, any questions?
Sure, absolutely.
We can include that in the recording, which would be helpful, I suppose, for colleagues in clinical practice if they're not able to link in today. Thanks, Paul.
Great. Good afternoon, everybody. So as Rita said, I'm just going to do a brief presentation just outlining the application process for the taught graduate programs. So I'm just going to share my presentation now with you. Is that appearing for everyone?
Yes, we can see that. Paul, thank you.
Okay. So I think the first thing to note really is, unlike with the undergraduate programs, the postgraduate programs, the applications for all of them are done via the online UCD website as opposed to the CAO. So undergraduate applications all go through CAO. Every postgraduate program we offer is all done via the online application system. And I know Emily's already given us a brief view of it earlier on, but I would highly, highly recommend checking the NMHS website in advance of applying for your program. It has the breakdown of every program we offer, the entry requirements for the program, documentation to be submitted, the contact details for the relevant program administrators as well. And it also has a link to the application system. So I highly, highly recommend using it. It's recently been overhauled. It looks great, works really well. So that would be my first port of call to everybody before you apply for a program. You've got all the relevant details you need on there. When it actually comes to applying for the program, if you don't go through the link on the website address is ucd.ie/apply, and then you click on the Apply to UCD button, which is highlighted there. And you'll come up to this option here, which is the screen you'll be seeing for application. So there's a course finder, which again, you can look up further information. I would advise going to the website to begin with. But when you're ready to start your application, you simply click on the Start a New Course Application box. It is important to note, because we do get a lot of return students, which we're delighted about, due to the number of postgraduate options we offer in the School of Nursing, Midwifery and Health Systems. People may have undertaken professional certificates before, graduate diplomas, now be doing a master's, maybe returning to a separate master's for whatever reason. If you have an existing UCD Connect account, please log in and apply using that. Don't create a new account. This just creates an issue further down the line when you come to register if there's duplicates on the UCD system under the same person's name. We can get it resolved, but it's much more straightforward. If you've previously applied for a program in UCD, use your own login details. And if you've forgotten, because it could be a year or several years past, the UCD student desk will be able to help you. So you can just click the forgot password button on your login and they'll take it. So yeah, it's really important if you've previously studied with us at taught graduate level to log in using your existing account as opposed to making a new account if at all possible. So once you start your application, you'll be greeted by this screen. Again, if you go through the website and the apply link from a specific program, this will auto-populate. If not, you just need to filter down to find your program. So the quickest way to do that is to use the program code. So in this example, it's the MSc Health System Management X722. And as you can see in the filter options section, you can simply just put in the code and it will pull up the program. So once the program appears, you can just click apply and it will bring you through. Oh, you can also click on the program itself, the hyperlink, to find further information about it. But it will bring you through to the application form. So I haven't included a photo of the overall application form here, just because they do vary a lot depending on program to program. But this is essentially what you'll see. So the first part of every application is the personal details, academic record, employment history section. So as you go down, there'll be options here to edit your personal details, which is here. And then there'll be a section further down as well for supporting documentation. So the supporting documentation will vary somewhat depending on program to program. Some have a large amount of supporting documentation. I'll come on to that in a moment. Some may be very basic. It might just be your NMBI registration. It might just be some form of photo ID. But you can just upload those to your application as you go. In relation to the programs which do have more documentation, they're all available to view and access and indeed download from the website. There'll be a section under the program entry called Documents to be submitted with your application or entry requirements. Any official form which needs filling out by an employer will be available to download from there. And there are set templates for things like professional references as well. So if you see that on your application checklist, you can find these forms on the course webpage. So once you submit your application, you'll receive an email just to clarify that your application has been received. You can track the progress at any time by logging back into your application. As changes in the status of the application are made, you may be issued an offer, a conditional offer, there may be feedback from the program administrator or program director. You will again receive an email notification to say the status of your application has changed. To view what the update is, you simply log back in. You can also continue to edit your application once submitted. So you can submit your application and then continue to add support documentation after the fact. If you have a form, for example, that needs a director of nurses signature on it, if your DON if you're unable to access them for whatever reason in advance of the program application deadline, you can submit your application and then after the fact, submit the required form. Now, with this, I would say, obviously, you have to make sure the program director is aware of this. And it's really not for trying to submit documentation after the application closing point, which I'll come on in a moment, but it's just if you want to submit your application prior to the application closing period and you don't have all documentation there and then, that's okay. You can submit your application anyway with your personal details, and then you can add in your documentation as you go. You don't need to submit a new application, you don't need to withdraw your old application, you can edit it as you go. The vast majority of our programs, the numbers are capped. So it's advisable to submit as soon as you can once the program application system opens. A lot of programs also operate on a first come, first serve basis. It is worth noting the programs that have high intake numbers every year often sometimes the numbers have to be capped. And the only fair way to issue offers to applicants in that case is on a first come, first serve basis. So if you're thinking of applying, but you're putting it off for whatever reason, I would highly advise that you don't, just because if the place is filled prior to your application, unfortunately, there's nothing we can do and you will have to wait to the following application cycle. Just some further information. So there are two intakes for graduate talk programs. There is the summer term, which begins in September, and the spring term, which begins in, trimester. The summer trimester and the spring trimester, which begins in January. The closing date for the summer applications is the 31st of July. So this is the set term across all our programs, the agreed upon date with program directors. There are one or two exceptions to this. Certain programs, for whatever reason, may choose to close early. I know the Masters in Advanced Practice, for example, closes the month prior, I believe the end of June. But the vast majority of programs will close on the 31st of July. If you have any issue getting your application in prior to that day, you will need to contact the program administrator and the program director to let them know of your circumstances. In very specific scenarios, sometimes late applications may be accepted, but it's a rarity as opposed to the rule. So I can't stress enough how important it is to get your application in prior to the 31st of July. And if you're unsure on if the program you're applying to, if it does have an earlier closing date for whatever reason, just ask the relevant program administrator. Again, they'll be in touch with you via your offer process, but you'll also be able to find their details on the NMHS website. And the application period for the spring trimester, so any programs beginning in January, the closing date for that is the 30th of November. So again, exactly the same as the summer. Make sure you get it in prior to that date. And as I said previously, the earlier you do it, it just stands in your favor more, specifically if it's a program that has a large number of applicants coming in for it. And as I've already mentioned as well, some programs require specific forms to be completed and uploaded. These can all be found on the relevant course website for the course in question. They're all available to download from there. There's links from it, and it also tells you any other information you need as well. So I will finish my presentation, as I said at the start, I highly, highly encourage you to study the course website first. You get all the information there, general questions, also links to fees, information, everything like that. Once you have gone through the course website, if you then contact the relevant program administrator or program director for further questions, or submit your application. And that's everything. So that's an overview of the Talk graduate application process.
Thank you, Paul.
If anyone has any questions, if you'd like to put them in the box or raise your hand, or happy to assist.
Thanks very much, Paul. It's very helpful. Yeah, as you said, the step-by-step process is there, but it's kind of helpful just to visualize the portal.
Yeah, absolutely. And these, as I think, as Emily already mentioned, these slides will be distributed to everybody afterwards. So just as you're going through, it might be handy to have them just as a reference to make sure you're in the right area and things like that.
I suppose the important thing, and to reiterate, Paul, what you said, we're here continually to follow up on any queries and all queries. And we're very fortunate, our colleagues, our admin professional colleagues in our office with us. Each program is a dedicated colleague who's working with the program, with faculty on the program. So we're on a team approach, and we're very happy to follow up on any questions or queries that you might have. I'll just share my screen just to put up the last slide that I had there, because I just want to reiterate about our web page. Sorry, I want to get the slideshow. So you can see our link there in the same way as we just flagged links for research and for application, but the NMHS website, which, as Eileen flagged earlier, recently overhauled and much more better than heretofore, is available there for you on that link. And you know, all the information across all our graduate programs is there, and it's, you know, there are so many diverse, and I suppose it's such a wide variety, but all the information, we'd love to hear from you. We're here, and if you're ready to pursue a program of study, we're very, very happy to hear from you. Our social media links are there, and our webpage. So just put up the links there at the end for you to think about. But if anybody wants to ask us anything or anything specific, or we can follow through either with program directors, if we can give you email addresses if you need.